Hey all, this is Dr. Sarah Winward from your Downtown Doula. I'm a naturopathic doctor and board certified lactation consultant. And we just wanted to talk a little bit today about Ramadan coming up. So our team has had a lot of questions from patients about fasting while nursing, and so we wanted to talk a little bit today about that. So the first thing I wanted to say is that fasting is not obligatory if you are nursing or pregnant. So it's totally up to you whether or not you decide to fast. It's not obligatory. If you are thinking about fasting, I would pay special attention, especially if you are exclusively nursing or exclusively nursing, especially a baby under the age of 6 months old. And you want to be mindful about both your supply and how you're feeling. So things to look at in terms of supply would be looking at your baby's temperament. So are they, asking, like cluster feeding, asking to nurse all the time? What's their output like? Are they more tired than usual? That kind of thing. But I always like to tell people that your body will make nutritionally adequate milk to the detriment of you. And so it's much more likely that you're going to start feeling signs of dehydration before you notice them in your baby. So really make sure that if you are fasting, pay special attention to how you're feeling. So if you're having like headaches or darker colored urine, anything like that, those would all be reasons to break your fast. And then if you're fasting, make sure that you're paying attention to getting the hydration that you need and the calories that you need. For people who are exclusively nursing especially, you need about 500 extra calories per day in order to maintain yourself and that milk supply. So making sure that when you are eating, you're getting in enough food and enough water. So some of the tips we had from our team was to make sure you're getting like at least a liter of water in the morning before you start fasting. Try and make sure you're getting a good meal in the morning before you start fasting. You can consider swapping out some of your water for things like coconut water or adding electrolytes to your water so that they're a little bit more hydrating for you. And then have food with you overnight. So if you're waking up to feed baby, have really nutrient-dense snacks available to you that are easy to eat, things like protein bars, nuts, trail mix, anything like that. That's really easy to eat. And even because I know people don't like to eat a lot early in the morning, but even if you're just having a few bites every time you wake up to feed baby, that's going to help get you those extra calories. And then the last thing is, if you are choosing not to fast, a lot of people feel left out. And so we had some suggestions on things you could do instead of fasting to sort of still participate in Ramadan. So for example, if you want to choose to give up a food or a food group, maybe something that is a little bit less on the healthy side, or do a modified fast where you're maybe fasting from food but still taking fluids, or consider instead either putting money aside to donate to feed people who are less fortunate, or making food for family and friends. So those are our tips. If you have any questions, please feel free to reach out to any of the lactation consultants on our team, and happy Ramadan to everyone celebrating.